We listen and we don't judge.
When I was a newer nurse, I was doing CPR on a patient, and when we paused to shock him, his arms flew and it hit me, and I flew off the stool across the room onto the floor.
We listen and we don't judge. One time I walked into a patient's room, told her that she had an amazing tan, but really she was just jaundice from alcohol cirrhosis. We listen and we don't judge.
The first time I had a patient pass away, I took my stethoscope and I went to listen to make sure there was no heartbeat, but I was so nervous and my own heart was beating so hard that I couldn't tell if the heart was beating, and the entire family was hovering around the bed. So I told them that it was our policy that they had to have a second nurse come in and listen, and I ran out and grabbed my charge nurse and begged her to come see if the heart was still beating.
We listen and we don't judge. I still feel that way sometimes. Like, what am I hearing? I don't know what I'm
They were
hearing.
like, is she gone? And I'm like,
I don't know. My first time doing a 3-way Foley catheter, I did not know that the bag was unclamped. So I flooded this man's bladder with a huge amount of fluid, and it started coming out underneath the door to his room. We listen and we don't judge.
One time I was going to give a patient their Lovenox shot, and after I took the cap off, I accidentally pricked my finger as soon as the cap came off, and I freaked out and thought I had a dirty needle stick and thought I had to go to the ER and get like an HIV panel, but it was a clean needle.
We listen and we don't judge. One time I was taking care of an elderly patient, and every time I was helping him use the urinal or anything else, I noticed that he was relatively excited to see me, which made me feel kind of awkward the entire shift. Until the very end of the day, he must have noted that it made me uncomfortable, and he told me that he actually had a penis pump implanted. We listen and we don't judge.
One time when I was working night shift on the cardiac unit, one of my patients' troponin levels came back critically high, so I called the cardiologist in the middle of the night to let him know. When he explained to me that the patient had had a stent placed that day, and that's completely normal, and not to call him back again.
We listen and we don't judge.